Everybody, all mics up now, ready to roll. Thanks for the introduction, Marianne. My name's Andrew Wyborn. I run a technology company. It's UK based. We're based here in London, called Greenmash. We're a software and services organisation, and we develop applications to support the work of health programmes in difficult countries. So we currently work in 12 different sub-Saharan African countries, and we're just starting a new program next week in Pakistan with Novartis, Access to Medicines program. The platform that we develop is called Mango. Mango is a general purpose mobile application platform. So when I say general purpose, it means that we can create and deploy applications for all sorts of different requirements. So most of the work we do is in health, but Mango is just as comfortable supporting education programs, agricultural programs and so on. But to date, most of our work has been in the health sector, and we've done a lot of work with NTDs, which I'll come on to shortly. So some of the applications that we work with, we do a lot of work with monitoring and evaluation programs, surveillance, routine surveillance and event-based surveillance applications. We create early warning systems to give that real-time visibility over events. We do a lot of work managing supply chain, and a lot of these things are linked together. Do a lot of case management, referrals, and we can create electronic vouchers to distribute for products and services. So a little bit about the product Mango. So Mango is a platform, it's a software product we call a platform, and we can create the applications on the platform there. And this diagram is designed to illustrate this is where the magic happens, so to speak. This is where we create surveys, we create rules around the surveys, deploy algorithms and workflows and so on. We have multiple ways of collecting data from the field, so we can use whatever's available. So we do a lot of work with programs where all that's available in the field is a basic handset, an old Nokia brick-type phone. So we use a lot of work with SMS or USSD. If people have access to smartphones, we have an app that can be downloaded and then linked to the Mango site. We can enable people to push data straight into Mango if they have internet connectivity. We can digitize paper if we need to, and we can pull data in from third-party systems like biometric recognition tools, drones, QR codes, barcodes. So whatever the data source is, we've got a way of connecting to that data source. And we bring that data in, turn it into information that's digestible and usable, and then disseminate that data and again, in the most appropriate way. So we can push reports, charts, and maps through the Mango web interface. We can distribute email reports, kind of snapshots of what's going on a regular basis. We can use SMS to ping people with urgent updates. And we can also integrate Mango with other core systems. So DHIS2, as an example, is a widely used management information system in low and middle income countries. And we do a lot of work integrating with that and other systems. Some of our clients, so in the NTD sector, we do a lot of work in many countries with Sightsavers and with Find. And in the other health areas, we work with some of the partners are showing up on here. And they all, in turn, get their funding through the usual suspects. But the common thread through the work that we do is that we're collecting data from some really tricky environments. So we work in a lot of East African countries, but we work in DRC, Chad. We've done some work in Somalia. So, where it doesn't have to be a stable country, we can work in tricky countries as well, and just use whatever services are available and connect our Mango platform to those. The data itself to us doesn't really matter what it is. It's important, the important part of the data is that we understand what it is we're collecting and why we're collecting it. It can be indicator-based or event-based. We can collect aggregated or individual level data and treat it accordingly. The idea of Mango is it's a tool to translate that data into something that's meaningful and pretty much in real time. So we can collect data from a community health worker or a primary health facility, bring it into Mango and trigger an action within minutes. The idea is we make that information available to multiple participants at all levels of the health system and irrespective of where they are geographically, because Mango is deployed as a cloud-based service. And the idea, again, is to enable informed decisions. So we're trying to get data to support informed decision making. So applying this approach into the WASH sector in support of the SDG 6 and the Joint Monitoring Programme, I just stole some quotes off the UN website, but I think we all understand the value of data. The key one, the high quality data, helps to identify challenges and set priorities. And again, we monitor all the key, or we can monitor all the key indicators for monitoring SDG 6. But in addition to the monitoring of those indicators, we also support all the key activities. Sorry, it slipped down there, but we do a lot of work with mass drug administrations. We've got a mass drug administration platform that we created in cooperation with Site Savers, and that's being deployed now over the next 3 years into 16 countries, and that gives visibility over the census data, matches the census data to the government figures and gives an instruction when to start the treatment, and then it monitors the treatment and then lets the field workers know when they can stop the treatment and start bringing the drugs back in, and it also monitors the drug usage and to improve drug management. We support behaviour change activities. We do a lot of work, as I mentioned, with supply chain. We can create and distribute vouchers for products and services. We can monitor and pick up adverse events, and we do a lot of work with reporting for early warning and response systems. So how does it work? It's not magic, it's pretty straightforward. So sorry, the slide's getting a bit mixed up here, but we agree a process. So the idea of a process is we sit down with a client before we touch any software. The idea is we need to know, what data is it you're trying to capture? Where's it coming from? Who's going to send it? What channels are open to them? Do they have access to the internet? Do they just have a basic smartphone? Are they literate? Can they read? How frequently do you want the data? What do you want to happen to the data when it comes in? Do you need to apply some algorithms? Do we need to trigger some workflows? So we map all this out in the simplest way that we can to make sure everybody's clear on what we're going to deliver. We create a specification, and then once we've got everything clear, we then go into this is a snapshot of the Mango interface from one of the Site Saver systems in Nigeria. We start to build the surveys and then the rules around the surveys. So this is the MDA platform for OncoLF and for Schisto. And then so if we go into those surveys, we then start to set the rules up around those surveys. So we design them, set up the questions, allocate the attributes that relate to each of the individual questions. We can assign messages and email templates to each of these surveys, so the whole thing becomes interactive. So if someone sends in a piece of data that says one thing, you can send them a message straight back immediately, or you can trigger an email alert to go out to somebody. Once you've got the design sorted out, you then click on this collection tab, so you then schedule your surveys. How frequently do you want them to go out? Who do you want to send them to? Which participants are taking part in the survey in this part of the country, in this part of the country? Which users are going to see the reports? What kind of workflows do you want to associate with that information? And then how do you want to analyse that data? Reports, charts, maps. We can overlay data straight onto Google. We have an API key for Google Maps, so we can just push data straight on top of Google Maps. And then the exciting bit is you start seeing the data coming in. And as I mentioned, we can use pretty much any channel. So for people who just have access to basic feature phones, the old Nokia style phones, we can use SMS, we can use this service which is called USSD, which enables us to push simple menus down to a basic phone over the GSM network. For people who aren't so keen on typing data in, we can provide IVR, which is interactive voice response systems. They can just call in and press the buttons that respond to their answers. If they have a smart device, we have apps for the smart devices. If they have internet access, they can push data straight into Mango. And as I mentioned, we have options for interacting with third-party systems, so QR codes, barcodes. We can interact with social media, such as WhatsApp. Biometrics, and even now capturing data from drones. And when the data comes in, what do we want to do? We want to use that information to make informed decisions. So, I mean, this is a screenshot from a system in Uganda for FIND, but it's a disease elimination program. But these just an example of the types of reports and charts. And these are updated as the data comes in. So within minutes of somebody sending an SMS or uploading a form, these appear, these are refreshed to give you the latest view of activity in the field. They can be tables. So again, this is a screenshot from SiteSaver's MDA platform. So this is the sensor survey. So it's telling them, it's giving them real-time information of where the activities are taking place, what the estimated population is, what the censored population is to date during this MDA, what that represents as a coverage, and what the instruction is to the field workers, continue the census, start the treatment, and so on. So this information isn't just available to the users accessing Mango. The instructions, as I say, are going back down to the field workers as well. It works online and offline, so you don't have to have an internet connection to be able to see at least a cut of the latest set of reports. And you can collect data offline as well, and then synchronize that when you have an internet connectivity if you're using smart devices. The data can be aggregated data, or it can be right down to individual level. So in this FIND program in Uganda, this is a HAT elimination program, sleep and sickness elimination program. So they need to be able to track individual cases through a process of testing. For data that doesn't fit, into a particular box, you can push, you can set rules around, if data falls outside of expected parameters, you can push it into inboxes and direct it for members of your team to take action on. Say, look, have a look at this data, tell me what you think, are we going to approve it, reject it, delete it? So this is all related to the workflows that we've set up around the surveys. And obviously what we're doing is delivering solutions, but they've always got to deliver benefits, otherwise it's very hard to get any funding. So the key benefits that our clients tell us they get is that what we provide them with is an end-to-end solution for the collection, management and reporting of data, raising awareness, promoting benefits and so on. We can enable them to respond to events in pretty much real time. We can validate and verify that data in real time, triage the data to make sure it's accurate. We can refer and track specific cases, like in the FIND program in Uganda I just mentioned. SiteSavers have done a really neat case study of their initial work with us in Cameroon, which showed that they were able to reduce the time in the field for their MDA from 3 months to 2 months. Increased their coverage by more than 10%, and despite all of that, they still saved almost $70,000 US, and that was just in a pilot in one half of one region. So now, and that gave them the impetus to then invest in this global MDA platform. Saves money because we can get data from the field in real time and update reports and charts within minutes, and we can exchange data again in real time with pretty much any other information system. I think this is the final slide, just to summarize some of the solutions that we've got experience of deploying, and a summary of hopefully a summary of what I've been saying. It enables our partners and clients to prepare, respond, communicate and monitor their programs in a much more effective way. It's affordable. We've got some great case studies to show the proven benefits. We can deploy Mango applications rapidly because we're configuring applications rather than creating from scratch. And as I mentioned earlier, we deploy Mango as a web service. So we provide a full package of ongoing support as well. Thank you very much.